Doing live, we're live. Hello everyone, this is Robin Bartletti back again with the second Teach and Share. I'm happy to be here with Dr. Amulya Tatachar from the Pharmacy School here at University of North Texas Health Science Center. Before we get started, just a few housekeeping details. The first one, if you look in the conversations area, I have posted a link to the session. It's not showing up yet. Let me try it again. There we go. And if you're watching this through YouTube, then you won't have access to the Q&A. So that link will take you to where you can actually answer questions. If you are watching this through a mobile device, you'll be able to see the question and answer, but you won't be able to ask questions. The broadcast is going to be recorded, and I'm going to post the link where it will be living into the question section. So you'll be able to go to that short link and see a recording, see any additional information, and then Dr. Tatachar has graciously accepted that we post her email address on there so you can ask her questions specifically about the activities we're going to talk about today. And with that, the name of our session is Active Learning Exercises in a Recitation Course. And I am going to turn this over to Dr. Tatachar and ask who she is, what she does here at the University of North Texas Health Science Center, and let us tell us a little bit about herself.
Hi, thank you for having me. Again, my name is Amulya Tatachar. I am an assistant professor at the University of North Texas College of Pharmacy. And I'm currently a course director of a pharmacotherapy recitation course. This course is a team-based learning course with the purpose of really trying to reinforce concepts and also apply concepts from pharmacotherapy modules, which are held concurrently with the recitation course. I also teach in the pharmacotherapy modules, and these modules are based on disease states. So currently the students are going through cardiology, which is a tough subject. So we do recitation, which is essentially the application portion of the didactics in the pharmacotherapy module.
Great. So what in general are active learning exercises, and what made you want to try them in your course?
So just to kind of a brief history of the College of Pharmacy. It is a new program. We have our first class that's graduating in 2017. And so this pharmacotherapy recitation course was first offered to the students in fall 2014. And so we wanted to really try to integrate the recitation course and tie it into the pharmacotherapy module. And the sole purpose is really to start developing critical thinking skills and application skills for the students. And as we all know, that active learning really does help with improving student performance and student learning outcomes, and most importantly, helps with developing critical thinking skills. So we wanted to implement different variety of active learning exercises in our recitation class to not only develop those key skills that we would like in a pharmacist, but also just to have some fun with it. I feel that when students are passively acquiring information in a didactic session, sometimes it's just nice to kind of take a break and do some active learning so that they're the center of the learning rather than it being focused on the faculty member. And so that's why we wanted to use these active learning exercises in this class.
So tell us a little bit about the different exercises and how you use them in your courses, how you set them up, do you use templates? Just give us a few examples and tell us about them.
Okay, so well, because this was first offered in fall 2014, we wanted, and I was actually just starting out at UNT at the time, and I didn't really know the class. So in order to really tailor active learning exercises, what we did is we called it a pre-assessment survey. So we gave the survey to the students during the first session. And what I wanted to know, it was a free-form survey, open-ended survey, and we asked students to talk to us about what are their short-term and long-term goals, what are their goals for this semester, what are their specific interests in the pharmacy field, and what were their areas of weaknesses that they wanted to improve on, and strengths. And what we did was, the common areas that we found were that students really wanted to gain confidence, they wanted to increase their pharmacotherapy knowledge, they wanted to really start working on public speaking and just communication skills, along with many other areas that they identified. And so we created these active learning exercises, particularly educational games, because we saw that there was a lot of literature supporting the use of educational games. And we thought, well, why not try to use it in a pharmacotherapy recitation course? And so we did games like Taboo to kind of review the top 200. These are commonly prescribed medications, and students throughout the curriculum are expected to know the brand and generic names, the drug classes, adverse effects, and all the information. So we did Taboo. We also did a Jeopardy-like game, so that was really fun. Just very similar to what you would see like normal Jeopardy. Students were put into teams, and they had categories on a particular subject and a monetary value, and so forth. We also did an Uno-like game. I did that when I was a little kid, played the Uno game, but essentially kind of follow the same concept, is that you're trying to get rid of as many cards as possible for this exercise, and you would win. So we did a bit of educational gaming in fall 2014. We also implemented, well, when I started learning more about Peerwise, which is a web-based technology, and it's a great platform for students to create multiple choice questions. And it's great because students not only are able to create multiple choice questions, but they're also able to answer their peers' questions. They can rate their peers' questions and provide constructive feedback. And so we started implementing that in our class because we found in the literature that there was positive outcomes on student performance, along with student perceptions, that students really enjoyed it. We also recently, actually a week ago, we implemented a debate series where we had students debate over a clinical controversy. That's very relevant to what we see today. And that topic was actually was aligned with their pharmacotherapy module. So it helped prepare them for the exam as well. So it kind of was a win-win situation. And we had students create an opening argument, they had to do a rebuttal, and they had to do closing arguments on this clinical controversy and compete with another team. So yeah, and then we've done teach back, counseling. I mean, we've done a variety of active learning exercises in the class over the last 4 semesters.
So I'm just wondering how the students react to these exercises. A lot of times in college classes, you get lecture and presentation and not much interaction. So how do your students, how they reacted to these kinds of things?
So that's a great question. So we wanted to ask that question too, because we were first implementing this course and we wanted to see, okay, what were students thinking about it? And specifically, we were very interested in finding out the student perceptions of learning and satisfaction. So in fall 2014, we implemented 8 different active learning exercises that I briefly mentioned. And in this post-assessment survey that was done at the end of the semester, it was a closed-ended and open-ended survey, and we asked kind of about 3 things. First was, what were your perceptions? We asked the students, like, what were your perceptions of learning? And we talked about, did these active learning exercises, and we ranked each one. We listed each one, and we had them kind of describe each active learning exercise to give specific feedback to each exercise. So we asked the students, okay, so on a scale of 1 to 100, what did you feel that this active learning exercise did for your level of competence? So did it improve your understanding of the material, and how much effort did you have to expend on the exercise? We also asked students, well, did they enjoy the exercise? Did you feel very tense doing the exercise, and questions of that nature? And then the last part of the survey was asking, well, if you were given the choice, would you continue participating in this exercise in the future courses? Because that kind of gave us an overall idea. The students really felt that this was beneficial in their learning and also that they enjoyed it. And what we found really was Peerwise and Jeopardy ranked the highest in terms of satisfaction in learning. And so student question creation definitely was perceived positively, even among all of the active learning exercises. We had great positive feedback in the open-ended portion of the assessment. And then Jeopardy, I think just people liked it because it was familiar to them. It was something different. You know, it wasn't just only cases. And it was very interactive and somewhat competitive. So some students liked the competition with it. So those were the two highest ranking of all of them. And overall, when we got course evaluations, we had really great course evaluations because students liked the variety. They liked that it reinforced information from their pharmacotherapy modules. So overall, students have been perceiving it pretty well. And you know, they did give us really good constructive feedback for the next semesters on how to improve upon the exercise because this was the first time we implemented it. But overall, really good feedback that we got.
So will you be publishing your results?
Yes, so right now we're in the process, our manuscript is in the process of being published. In addition just to even student perception, we also were looking at outcomes. Do these active learning exercises also affect the student performance? So because we had such great feedback on Peerwise, and we know we've had so much literature backing up Peerwise on student performance, there really has been lacking literature in the pharmacy education. So we did kind of a pilot study where we compared Peerwise to the traditional case-based learning. Like we would give them a case and they would create, answer case-based questions. So we compared both of those activities. We did a pre and a post test. We also looked at their performance on their block exam, which was taken less than a week after the interventions. And then we looked at their performance on the final exam. And so while we didn't reach really statistical significance as far as the difference between both groups on performance, we did see that students in the Peerwise group actually did perform better, but again, it didn't reach statistical significance. And we just, probably because we didn't have enough test questions, and it was really a pilot study to see if there was actual positive benefits on student performance. And we were seeing that with Peerwise. So that was pretty exciting to look at.
But they did indicate that they enjoyed those activities, and that makes a difference. That makes a huge difference.
Exactly.
So I was just curious, in using Peerwise, did you have to do a lot of training or prep work with your students to show them how to use it? Were they confused by Peerwise at all?
So the first class, yeah, there was a little confusion even among the faculty because it was the first time we've ever done it. So that was a little interesting because, but overall though, it went very smoothly. It's very user-friendly web technology, and all we had to do was give specific, clear instructions as to what the expectations were for the students. So how many test questions did they have to create? What kind of comments did they have to give? A positive and constructive comment. How are they supposed to rank? So I think that we did as much as we could from the back end and preparing for participating in any challenges. But of course, we came upon a little bit of challenges, but it was just a hiccup. It really wasn't, it didn't deter from their learning. So that was great about Peerwise. So really, it was very user-friendly. It wasn't hard. And the second, third time around that the students used it, they didn't even have to ask any questions about using it. So, and I feel like with the learning style now is that technology and using telehealth and all of that really appeal to the students. And so I think that they like that innovative approach to active learning.
Okay. Can you tell us where you got your template or tool that you used to create the Jeopardy questions and how you did that?
So that was actually done by another faculty member who was leading the session, and she created it herself from scratch. Online, there are some templates that you can use. However, you kind of have to play around with them. So I know that she looked from just an online. I don't know the exact source that she looked that you use for the Jeopardy template, but I can definitely find that out, and if anyone wants to email me, I can definitely send that link.
Okay, and was that a PowerPoint template?
It was a PowerPoint, sorry. Yeah, it was a PowerPoint template, yeah.
Great. Let's see, a couple of questions from the audience. Do you use a rubric for scoring Peerwise?
Yes.
And will you share it?
Yeah. So we're working on the rubric. We're still finalizing it, but we've given a rubric to the students because we wanted to obviously give them the expectations of how we grade multiple choice questions, and the clarity of the question and the quality of the question, and how if there's no grammar, free of grammar and spelling errors as well. So we definitely have a rubric, and I would definitely love to share that with you.
Okay. Let's see what else. How are these activities scored? In addition to Peerwise, are the other activities scored in the class? And if so, how much do they count towards the students' grades?
So this class, so just to kind of give a brief structure of the class itself, they have 10 points that go for an individual readiness assessment test that they take at the beginning of the class. And this is a 5 or 10 question quiz that accounts for 10 points. And the active learning portion actually accounts for 20 points. So, and then they have 5 student participation points. So for the active learning, depending if it's a case, we have a rubric that we post online ahead of time that we give to them weeks before the class, and then we use that rubric. And that rubric is supposed to give 20 points for the active learning exercise. For the student participation, we have students either submit something ahead of time for class, pretty much trying to get them prepared, or they have to speak during class to get the student participation points. So that's kind of, each session has 10 points for the IRAT, or the individual readiness assessment test, 20 points for the active learning, and 5 points for the student participation. And we have a total of 10 to 12 sessions per semester. And that's how we grade. And so as far as the grading for active learning, we usually have a rubric that is equal to 20 points, and that's how we use to grade the active learning.
Mm-hmm. And did you say how many instructors you have in your class?
So that's the biggest challenge in a new school. So I'm there for every class, and then we ask one faculty member who's teaching the didactic portion in the pharmacotherapy module to come and lead the session in the pharmacotherapy recitation class. However, there are some active learning exercises that require multiple faculty members to be a part of, because the challenge that we have is our class is conducted once a week over 2 hours, and we have all students that come. So we have all 75 plus students in the class who we're trying to do the active learning exercise with. So there's some pragmatic challenges as far as getting enough faculty member, women power and manpower to really be there for each individual student to really engage them, or the teams that they have. So we have at least 2 members that we at each recitation session, but ideally it would be great to have, maybe 3 or 4 to really try to engage with the students a little bit more.
Do you have teaching assistants who can help with that?
No, we don't have teaching assistants.
Okay.
That would be great.
So I know you talked a little bit about how these assignments and active learning activities work, but tell us, how is it working? Do you think the quality of the student learning has improved? I know you said a little bit about that, but have you noticed the students either coming to your class with a more positive learning attitude, or have you noticed that they are doing better just on a one-on-one basis? So
I think that as this class has developed, we definitely see that students are performing better. I think particularly with the educational games, while it was fun, one of the challenges, it played more of a role of reinforcing information than rather developing their critical skills, I would say, from my experience right now with the class. And that's why we don't do as educational games right now in our recitation, because we're focusing more on that critical thinking and application skills. But we do feel that educational games can play a very great role in the curriculum if you're trying to summarize information, trying to reinforce concepts that you want to refresh on them, refresh the students on. But really, we kind of left behind those educational games and really implemented Peerwise and case-based questions in the debates, because those were the three active learning exercises that we felt really did develop critical thinking skills. And we could see that students were performing better on the exams with these new changes. And also they were integrating the information a lot more efficiently, which is also great. So we wanted them to be very efficient with doing this active learning exercise, because time is of essence when you're in practice. So that was kind of another skill set that we're trying to teach them as they progress throughout the curriculum.
So just to give us an idea of what the rest of your class looks like, what are the additional assignments and activities that you do? I'm assuming that you have traditional lecture as well as other things?
So the traditional lectures are actually during the pharmacotherapy modules. And so those are conducted over 8 to 9 hours in the week. And then my class is 2 hours once a week. And so what we do is we mainly do right now just case-based questions. But sometimes I think students get overwhelmed with having a case every single week. And I completely understand that, because when I was a student having a case every single week, you kind of, it's that lack of variety sometimes. I don't know, there might be some challenges as far as engagement of the student. So what we do now currently, and what we found to be pretty much the most effective, and we're seeing it in student performance on their on their exams, is that we do about 4 or 5 cases, but we present the cases in different ways. So it's still case-based, but we've done it like the beginning of the semester. We did a patient simulation where they had to interview a mock patient to collect the information and create a SOAP note. The other type of cases is that we give specific case questions, like what are the supportive findings for this diagnosis in this patient, and they just list it out. The other one is that we ask them to do SOAP notes. So this is a very typical form of documentation, particularly in the ambulatory care settings. So we have them write SOAP notes. So we try to add variety. We still give them a case, but we add variety of how we want them to answer the case. And then we do we'll do like a debate. We'll do something different like every 4 or 5 sessions that are not really that case-based, so that adds that variety and something different to look forward to.
Yeah, wow, that sounds really interesting. It sounds like a lot of work. Do you feel that doing these different things take you a lot more prep time up front than just doing regular lecture and things like that?
I definitely think that, because I do didactic lectures too, I think they both take a lot of preparation, but I definitely think with recitation, it's more of a different way of thinking. Because for didactic is you have a textbook, you have the information, you have experience in it, so you know kind of what your expectations are when you're creating your didactic lecture. But for recitation is that, and every class has its own personality, so you try to tailor the active learning exercise to ensure that you're meeting the expectations of the students, you're meeting expectations of the faculty members as far as, they want them to have good student performance. So more creativity sometimes, I think, with the recitation session, which I like that. So I enjoy doing this because I like that creativity that comes along with it. And I like seeing students really being challenged. And so I think that this is definitely a very different form of teaching than my experience with the didactic. But it does require a lot of preparation. It does require very clear instructions so that you don't frustrate students if it's disorganized. Because with active learning, when you frustrate students, then they become disengaged very quickly. So really being prepared, anticipating any challenges that you would see in the class itself.
So I know that this is a question from the audience, and I know that other people are going to want to know this too. Would you be willing to travel somewhere and do a workshop on how you set up these kind of activities in your classes?
I would love to. Yeah, that would. Yeah, I think that would be really fun, and I definitely think that I wish I went to a workshop about active learning, but I've just read a lot of literature on what was working before I started developing this class. And that really helped gauge me, but sometimes it's just nice to have an in-person workshop. So I would definitely love to do that.
Okay, when we post this recording with the information, we'll also mention that you are available for those kinds of consultations, and then hopefully people will contact you if they're interested in that.
That would be great.
So I only have one more question, and we're about 5 minutes from when we're supposed to end. I'll wait a couple minutes and see if we have any more audience questions. But is there anything else that you want us to know about you, your courses, or these assignments? And let me just say, to me, listening to you talk about it, I can tell that you're really excited and enthused. And I love that you like doing the creative part. And so the fact that you're willing to share the information is really, really cool, because a lot of people don't do these kinds of things in their classes because they just don't know how to do it, and being able to see the model for that. So is there anything else, any words of advice or things that you want to tell us about your course or about yourself?
So as far as, I think the biggest challenge I had with some of the active learning is trying to create rubrics. And I feel like for me, that is, as a new faculty member, creating rubrics is something I've obviously never really had experience in doing. So for a lot of these subjective type of active learning exercises, especially for educational gaming, I felt that it's very hard to create a rubric. And so at some points you kind of think, okay, should I just do it as a completion grade? I don't know, and so you're not really assessing it like you did. And so I think that was kind of the biggest challenge, is trying to create a rubric for everything. Because there's also different portions to an educational game. It's public speaking would be one rubric. It's, their pharmacotherapy knowledge is one rubric if they, showed competence in the different areas that we're assessing. So I definitely think that when you think about active learning, and it's something that I'm learning now, is to first, when you're designing it, first also figure out how are you going to objectively grade the students on this active learning exercise. Because it's a lot easier in didactics to see how they do on an exam and how they perform on, test questions. But active learning, the challenge is how do you objectively grade them? So I think that's something that I'm still learning, and it's been a very great learning curve for me. Also that really trying to incorporate active learning exercises that truly develop critical thinking skills, and trying to figure out how are you going to assess that this has really developed the critical thinking skills. And so the first pilot thing that we did was really trying to see, did it affect their performance? And we want to do this on a large scale where, we do this over multiple years and see truly if there's a significant difference between different active learning exercises. Because right now in pharmacy curriculum, we use case-based questions, and those are very traditional, what we typically see. But what about if we introduce something different, and does it affect their performance? So I really just implore people to really be creative and try to think of maybe something different that literature supported but hasn't really been done in your class, and trying to think about how would you implement it. And I think the other thing is, for me, I guess the biggest challenge in this is, and maybe it's the setup of our class, is that we're doing active learning for all 75 plus students in one class. And my biggest passion overall is to how can I motivate students to be engaged in the material. And that's where I feel active learning plays the biggest role. But when I have 75 plus students, it's like, how can I individually try to engage all those students? And so that's why I think that active learning, that's why maybe asking them about what are your interests, what are your areas of strengths, what are your areas of improvement that you like, so that you can try as much as you can through the active learning to address it too, and to show that you're really invested in their growth outside of just learning the pharmacotherapy knowledge, but really that you're invested in their growth and you're trying to motivate them. So those are just a couple of things that I've learned from this course and hope to continue growing it.
Great. Well, I just want to thank you so much. I know you're really busy, so we appreciate you taking the time out to talk about your assignments in your course, and you've given us just a rich load of information. So remember that the broadcast recording, as well as any additional materials, will be posted on the link that is in the conversations area. It's https://wp.me, and then some numbers and letters. You'll see that listed there. And thank you so much, Dr. Tatachar, for taking time out to do this. And I'm sure that we will be talking to you in the future again.
All right. Thank you so much. I appreciate you having me.
Thank you.